Hello, my name is Laura McDaniel. My program proposal is Biofeedback and Relaxation Training Therapy to increase the quality of life for cancer patients. So I want to start talking about integrative care and how important it is. Cancer is the most common disease among society next to heart disease, and many people suffer with stress, anxiety, hopelessness, and a loss of well-being with their diagnosis. So by implementing a program with integrative care, such as biofeedback training and relaxation therapy into standardized cancer treatment, along with chemotherapy and radiation, it'll help improve the quality of many cancer diagnoses. And this will allow us to decrease cortisol levels, which is stress, and anxious thoughts and feelings. And we can do this by changing a person's psychological and physiological stresses, thoughts, and bodily functions on cue. This is the need because cancer is the second leading cause of death, but we can beat it, or at least take some control of it. Because cancer is a demanding disease, it seems to suffocate our health, wants, and needs. Cancer weakens one's body both physically and mentally, and you believe you cannot live the life you're meant to live with the disease that makes you weak in all areas. But we can conquer these negative attributes by taking control and changing the way that we feel about ourselves. So the costs and consequences of an individual with cancer is that you have a weakened immune system. It takes a toll on your emotions, your time, your relationships, and your health insurance. And you may feel that you lost control over your body and your life and everything's just spiraling out. But with biofeedback therapy, we can give them a chance to consciously control their physiological changes and improve their life. The facts about cancer is that standard cancer care, such as chemotherapy and radiation, weakens the body as it fights the good and bad cancer cells. And this will weaken someone both mentally and physically, as well as emotionally. One study showed that diagnosis of breast cancer is a devastating psychological experience for women just because they lose a part of their womanhood. When the pain caused by cancer is not relieved, you may feel tired and depressed, angry, worried, lonely, and stressed. But when the cancer pain is relieved, you are more able to enjoy being active, sleep better, enjoy family and friends, eat better, enjoy sexual intimacy, and prevent depression. A few facts about biofeedback is that it allows you to create awareness to your physiological distresses and learn to implement different methods to decrease pressure, heart rate, body temperature, and your overall stress and anxiety you may be feeling. Biofeedback frequently enhances the effectiveness of other treatments when you use them in conjunction with your therapies, such as relaxation. Also, biofeedback provides training and self-care, shifting the responsibility for health to the patient, and it is free. It's something you can do in your own home during chemotherapy, in the office, just whenever you're feeling the need to take control of your body. And it's nice because there is no medication that you're putting into your body either. Some facts about relaxation therapy is that this training reduces the side effects that's caused by chemotherapy, such as nausea and anxiety. Relaxation methods bring your nervous system back into balance, and there's different techniques you can use alongside of biofeedback, which would be breathing meditation, progressive muscle relaxation, which is stretching and moving different areas of your body, such as your lower back and calves and arms and shoulders. There's the body scan meditation, and a visualization and yoga to help you with. So my program, I want to use biofeedback and relaxation, and the biofeedback correlates with the sympathetic nervous system. And this part, the SNS, reduces digestive secretions, heart rate, and blood pressure. And this allows us to consciously and voluntarily control over our processes. And we can change our psychological mindset and our physiological distresses. We can lower anxiety and stress levels and more control over emotions and improve the overall quality of our life. So here's my biofeedback and relaxation program model. The two pictures below show yoga as a relaxation method, and the guy in the chair, he is hooked up to a biofeedback machine so they can measure and tell him his different heart rates so he knows when he is feeling them. So with the diagnosis of a cancer, with any kind of cancer diagnosis, the most important and prominent treatment is either radiation or chemotherapy to kill the cells or surgery to take out the tumor. The side effects will include nausea, dizziness, weakness, depression, and anxiety. and it's important to consult with your physician to discuss your best option for pain relief and how to increase your positive self-worth. Different oncology centers are a great way to get to the basic training you need to change your physiological stresses and take part in a variety of relaxation and meditation exercises. The grief cycle that will come along with a cancer diagnosis, it may make you question your lifespan, and a person may go through all or just a few of these grief phases. And grief resolution promotes acceptance that eases emotional pain, and it helps increase acceptance of negative thoughts to move forward. The meditation and breathing during chemotherapy, this will be used through oncology centers that will provide relaxation meditation thoughts through story visualizations and breathing exercises. We'll use biofeedback to monitor the heart rate and other bodily functions. So after these training sessions, they'll be able to sense the psychological states that are rising and take control of it before it gets out of hand and bring it back into balance. And they'll be able to use this technique throughout everyday life and not just in the oncology centers. And they will also be very useful during chemotherapy treatment. Because meditation during chemotherapy, like I said earlier, reduces nausea feelings. The acceptance and commitment in cognitive therapy, through this, will allow you to focus on the present moment. You'll be able to live in the now and look forward to future events. And the mindfulness-based cognitive therapy is associated with the increased reprisal ability. So you're able to accept thoughts and feelings without judgment. And once again, continually keep moving forward in a positive way. The end result that we're hoping for is an improvement in quality of life. So different oncology centers will use this as a biofeedback relaxation method, and use acceptance and commitment as well to promote cognitive wellness. And this video shows you a small portable biofeedback system to show you how to get your coherence levels back in order when you might be having an anxiety attack or feeling uneasy. It'll help you get your breathing right back to normal. So the traditional treatment methods are obviously chemotherapy and radiation, and these are good at killing the cancer cells, but they also kill your good cells as well. And it does very little for your overall well-being, both emotionally, physically, and mentally. So what we want to do is focus on the mind and body connection. At one of my site visits at San Diego Cancer Research Institute and Oncology Center in Encinitas, they offer many integrated therapies such as art therapy and different mind-body techniques, and relaxation therapies like meditation and yoga, acupuncture. And after talking to them, they were thinking about certifying employers for biofeedback training and breathing to change the physiological states. My assessment clientele will be cancer patients. They'll be referred from their physicians to oncology centers that have adopted integrative techniques such as biofeedback and relaxation therapies. We will interact with clientele by getting them familiar with breathing techniques, mindful meditation techniques, and becoming aware of the psychological and physiological changes in their body. And the program will assess a pre and post test that measures their anxiety levels during the duration of their treatment. I will be using the extension stress scale measures, which measures cognitive, emotional, physical, and behavioral stress and anxiety levels, as well as a scale/diagram that will measure the patient's pain level. Here is an example of the stress anxiety scale, where they will circle on a scale of 1 to 5 from a lot to not at all. And the goals of my biofeedback program proposal are to reduce the feelings of anxiety and depression, to increase the quality of life and overall well-being, to have a positive acceptance of being dealt with the card of cancer, and the ability to consciously change psychological and physiological states. The Kubler-Ross grief cycle is one of my theories I'm using, and so find the stage correlated to the grief and the immediate thoughts of death when diagnosed with cancer. It's a change model for a different way to deal with a personal reaction and emotional shock in each stage. So we want to spin the negative thoughts that they may have in the grieving cycle into positive ones in order for them to cope. So the biofeedback training and breathing exercises will allow you to lower those cortisol levels and the stress levels that you have, the thoughts of death and bereavement, and it comes to terms with each stage of grief and help you continually move forward in your life. My second theory is Bandura's social cognitive theory, where a person's personal behavior based on cognitive and environmental factors, and people can have an influence over their outcomes because cancer may be caused by environmental carcinogens. There's nothing you can do about it. It's just, the card that you're dealt. But you'll be able to change your cognitive outlook and attitude on the situation, and this will improve happiness and fulfillment and the feeling of success within yourself. By using this theory, we'll be able to identify with the patient and how they perceive and interpret their diagnosis. The biofeedback therapy will allow the patients to become aware of their behavior and their physiological responses. Once they are able to recognize, they'll be able to change these in their body and prepare the discharge and unseated behavior, attitude, and cognition. Finally, these patients' cognition will be positively influenced using their surroundings and their environment and their personal behavior, and they'll learn to control these responses voluntarily. And once again, this will help with depression, anxiety, chronic pain, muscle tension, temperature, heart rate, and blood pressure. They'll be able to regulate their body with their own special relaxing thought and deep breathing. And this will reduce mood disturbances, improve quality of life, and decrease symptoms in cancer patients. The third theory is acceptance and commitment theory. It's to create a meaningful life while successfully handling life's daily stress and pain. So if cancer has you down, this mindfulness-based therapy will work hand in hand with biofeedback treatment to decrease stress, depression, increase the quality of life for cancer diagnosis, and to continually move you into a valued direction of your life. The ACT therapy will allow you to let go of any unhelpful thoughts. It will allow you to successfully engage in the here and now and experience the present moment. It increases your psychological flexibility, and it is aimed to repair and change and fix any unwelcoming symptoms and problems that are created, and it'll help you enrich actions, thoughts, and emotions in its place. Cancer patients will be able to use a combination of the biofeedback therapy and the ACT therapy to train their mind and change the brain structures and neural function. There's neurons and synapses in their brain. The mindfulness skills can be used as a biological marker to indicate their mind-body connection. This meditation and deep breathing relaxation will allow to discharge of negative thoughts towards their illness. So let's talk a little bit of evidence. From some of my research articles, I found that 98% of cancer patients reported increased physiological flexibility through the ACT therapy by accepting the unpleasant thoughts and feelings, and letting it lead to improvements in distress, mood, and quality of life. The psychosocial interventions that they used with the Bandura social cognitive theory allowed patients to identify concerns and cope with turning any problem into a positive problem. And they used solving imagery and positive self-intake about themselves. There's also an 18-month study on breast cancer patients, and it showed that the relaxation guided imagery that they used and biofeedback training showed reduction in anxiety and increased their immune system. And a research project with Dr. Bingham at CSUSM on chronic pain and biofeedback and relaxation therapy was that their heart rate and their body temperature and their muscle tension reduced when being read a visual guided story that incorporated muscle exercises and deep breathing. So here's the bonus of the program. It will not only provide a healthy outlook for the cancer patient, but also for their family, because their family and loved ones will be able to see that they're enjoying their life and they're not depressed and don't have any anxiety or anything looming over them. So the conclusion of my story, or my program proposal, is for the objectives to provide an increased quality of life and emotional well-being for a cancer patient, to avoid unnecessary pain and reduce stress and anxiety through mind-body connection. Using biofeedback training and relaxation methods such as yoga, deep breathing, visualization in order to change the cognitive and psychological status of cancer patients. My theories are the Kubler-Ross grief cycle, Bandura's social cognitive, and acceptance and commitment theory. So cancer does not have to bring you down. You can conquer it with a positive attitude and